Dr. Okaro. Okay, that's fine. Thank you. Good morning.
So we are with Dr. Ayo. We're now 2 days post-op, and you did really well with the pre-op diet.
I did.
Yes, the
I
pre-op
did for
is
2 weeks.
2 weeks, 14 days. You're on proteins, liquids, vegetables,
And I lost 5 kg.
5 kg in
I
2
lost,
weeks.
In 2 weeks, I lost 5 kg.
Which of course helps to shrink the liver, make you ready for the surgery,
And,
so it's
I've
safe.
been able to adjust to the sipping of water.
Good.
I can chew slowly. I noticed that if I take more than is expected from the small bowl, I get a bit tighter here.
Okay.
Even the pre-op.
Okay.
So it's really made me to adjust.
And it has made you like intentional and
mindful.
Okay.
Of the sipping and the protein shake.
Mm-hmm.
I had what I had yesterday was much. I couldn't take it, but the one Sherese prepared for me today was absolutely watery, and I finished it.
Good.
I was sipping it. Then the spirometer really helped me.
Yes.
Every 1 hour, I was able to get the 3 balls today.
Good.
About 4 times. I said, wow. And that was before the op too, until I got the 6 balls before I could go in.
Excellent.
So I've been able to adjust to the water. I've taken 75 cl 3 days now.
3 times.
3 times now.
Good.
I'm on the 3rd one, and I went out for my cleaning this morning.
Good, good, good.
So I'm being intentional about it.
Everything good. Yeah. So now, of course, on day 2, she's taking in her water well, her protein shake, and just that guidance of the journaling, the mindful, intentional, the protocol that we give you just to check off and make sure you're doing things day to day. Just really caring about our patients and making sure that they're doing what they need to, following up with them. And of course, we will follow up more and hopefully record, and you will see her journey as we go on.
Okay. Thank you.
So we're putting context so that obviously our audience can kind of see the reference. You had your lap sleeve gastrectomy 2 days ago.
2 days ago.
Today, it's Wednesday, I believe, the 21st.
Yes, I had it on the 19th.
Yep. So you're 2 days post surgery, and you look well.
Thank you.
You've been resting, which is helpful, important for the healing. And we encourage as much rest as possible, and then of course as much walking around. But you look well. You're tolerating your drink. You had a little bit of sickness at the beginning for a day, which happens, but you've kind of come over that. So that obviously they understand that you're demonstrating all the things that we feel is helpful in the preparation and the getting ready for the procedure, which is knowledge, which is information, which is being able to have a mental path or map of what's to come, but be willing to accept things that might change. And I think that's one thing. So I must give you a lot of credit for that, because you did a lot of research, you did a lot of reading.
I did. I went as far as the risk factor.
Yes.
I did everything.
All that. It is important. Informed consent is important.
I was well informed about it.
Yeah, and of course the other thing that you highlight, which is so important, is you have a huge amount of support from family.
Everybody, huge one. That's why I didn't travel out.
Yeah.
I said, no, I'm not going. I want people around
Nigeria.
Me.
Yeah.
I have it in Nigeria here since there's somebody here. So when I came in that early Monday on the screen, I said, oh, first in this. First bariatric surgeon consultant in Nigeria. I said, wow.
Oh yeah.
No, I saw
we have a few miles still.
Yeah, a few.
Over the years.
I said, so why did I delay? I said, well, I'm here.
Your time is good time.
I know. Yeah. I know.
And I think I know that. But your story, I think, is going to resonate as we, evolve the story around the fact that you took a decision, you acted, and we're 2 days post-surgery.
I am.
Of course, I'm very conscious that I don't want to. You need a rest, and I need to let you go home and rest. But the key there is to say, I think, congratulations. I must congratulate you. We're always conscious. It's very early days with surgery, and we have to be always cautious, vigilant. You'll be coming, obviously, to have your wounds checked every 3-5 days. You and I will see again probably on Friday. We'll wave, Friday. And then on Monday again, properly sit down and chat.
Okay.
Of course, Sherese, and the amount of liquids you manage will be just very actively monitored, as we do with our WhatsApp, and obviously checking how your urine and how you're going to toilet, passing gas. All of that will start in the next day or two.
Okay.
But just to say, yes, thank you.
Thank you very
well
much.
Done.
Thank you.
We keep praying, obviously, for continuous improvement. Yes, you've done it at last.
I did it at last. Yeah, I think I'll be able to tell people now that about why do you have to? Because I have friends that are big as well. That are big. And the first time I told them, they said,
you'll be surprised that they're not used to it.
Do it.
They're not used to it. It's not. Yeah, it isn't it's not a common conversation in Nigeria yet.
Then I noticed that a lot of people that did this gastric sleeve or whatever, they hide it. They hide the information a lot.
Oh, they do.
They will tell you, oh, they took Slim tea, they did this, but I know that is not the truth. Because I had an elder sister that did it. Why is it that people are not ready?
So
you see them, they lose the weight.
I'll give you my impression.
Okay.
As an individual who has experienced in my own personal life, admitting or being willing to embrace discomfort or even judgment by others. Because that is the bottom line. We are always anxious as individuals to be judged harshly by others. It's a common human criticism. Oh, I don't want to be criticized.
Only one
I don't want to be judged.
Came out with a full chest.
But then you need to look into the story. I am quite certain that individuals who have faced adversity in their life, whatever that may be, and have broken through, have probably come to understand some of the key components of having a full life. And one of them is to accept and maybe embrace some level of vulnerability, but more relevant, to realize that what people say about you or think about you really doesn't matter.
It doesn't matter. It's
having
me
said that,
and only me.
Correct. But having said that, that is still a massive milestone that most adults, depending on their circumstances, must go through.
Okay.
Yeah. That's one reason. The other reason that we have to acknowledge that when you understand, or when you begin to evolve the thinking spiritually in elevation of the mind, you begin to see human experience as broken into different components. Okay? You have the mind, you have the spirit or the soul, and then you have the body. Okay, are you with me? So when you do something to the body, which is the physicality of the body, that is going to enhance the body's maybe comfort. For example, get rid of pain or aches, or feel more nimble or lighter to be moving around the environment.
I thought my mind is not aesthetics.
Correct.
It's health.
Correct. So when you realize that, you understand that elevation of the body's just physicality feeds into the mind and the soul and the spirit, because they're interlinked. We know that by science. So people that understand that know that anything to improve the body as a direct act is actually a noble act for the spirit and the soul. And they're willing to say, because they're looking deeper. But that's why they have to reach that point. So the body is a vessel. The body is a vehicle. That's right. And when you stop looking at the body as a single standalone entity, you then can enhance it and then be quite happy to say,
this
because if they judge you, that means they haven't elevated their thinking.
Correct. This lady, Wari lady, one young lady, that went to Turkey.
Correct.
She was the only one. I studied her. She said at times she would just fall down. She had blood pressure at a younger age. That she will have events, getting there. She could not do anything. That she had to do it. She was the only one I saw, apart from your videos. And I see a lot of them. I mean, from my own side, I know what they've done. As an individual, as far as going to the Royal College, everything, I took it upon myself that, oh, everybody's mentioning Dr. Okaro. Okay. I called my brother. He Googled it. He said, yes, I've been on this, not for 1 or 2 years, that this is the person I want to meet. Okay, the first time I met you, you gave me the encouragement. I said, wow, surgery. That's the first major surgery I've had in my life. The first, and I told Sherese, I said yesterday was the first time I will have somebody clean me up. I've never had it in my life. I've been an independent person. So today they said, oh, Prophet, I said, no, I'll do it myself. So I went to the bathroom myself to clean up because I could see improvement in my mobility. And I'm conscious of not slouching back again. I'm conscious of it now. That okay. Then I went online to read about bariatric, uric care. Oh, okay. I'm getting somewhere. I was almost on it every day. Reading about it.
So you really were immersing yourself
honestly
in the whole,
this is the outcome, this is the pre, this is the post. And with the pre-op, when it came in, I said, will I be able to take this? Not for just because I'm a coffee person. So I've been off coffee for 2 weeks. I've been off rice for 2 weeks. Wow, I said, so it's possible to get things done. Just be intentional about it. Oh, when my kids are saying, Mom, you just have to do this. And I noticed that the way I'm working, it's not making my children happy. They're not happy. They said, Mom, you just try. Every day, like my daughter called this and said, Mommy, don't let us start competing in dressing again. So I could see the joy in them.
The relief
in them that said, then my daughter said, Mommy, my prayers are the next one after you've lost a lot of weight. I will look into your legs, my prayers. I don't have to do anything on these legs. So I noticed that is a source of concern.
They're thinking about the big picture.
Exactly. I'll go on holidays. I can't move around with them just like before. So definitely it's giving them concern, which I know. They've been pushing me. I ought to have done this thing since last day. I kept on pushing until my daughter had to call the husband.
Wow.
He said, now. They were together in America. I said, Mommy, what is going on? Tell me. He was the one that confronted me, my son-in-law. He said, what is it? Why are you not doing it? I said, you can't leave me. He didn't stop at that. When he came back, he had to come to Festa. I stayed in Festa. He said, are you afraid? I said, no, I'm not. I'm just, I don't know. I said, Mommy, try it. And that was it. He was the one that paid for everything. He said, okay, you go try it.
Wow.
And I'm so happy that I did it.
Your son-in-law?
My son-in-law.
Wow.
I'm so happy that I did it.
Wow.
Because I'm sure maybe the wife must have been feeling the other way with him, telling him, okay, you know, she listens to you, she believes so much in you. Why not try to talk to her? And so far, so good. I have no regrets. Tell me you're 140 something kg you're taking. I've tried Cambridge weight loss. I've tried this. I've tried that. A lot. So when you're talking, I look at people that know we're not, our mindsets are not the same. Our thinking are not the same.
Indeed. And and of course, we haven't even delved into the
people have gone beyond that
injectables, but also all the
Mounjaros,
so the whole
glutamide,
the whole thing is just a mixed bag of.
Definitely, there will be side effects.
Yeah, they are.
Because I know is it
semi-glutamate?
That's for diabetic people.
Yeah, they are. But it has. I mean, it's a GLP-1, I think, agonist. Now, the truth is that whatever you do, I think, to try and improve your health,
that's fine.
In terms of weight loss, needs to possibly be done in the context of a plan. So that needs some plan, maybe some advice, some pro and con assessment. And I think that is important because
very important.
You may start with one plan A and it doesn't kind of get you where you maybe got to go to plan B, or maybe plan C, and so on. And it may be like a ladder escalating, kind of activity. But it's always nice guided by, clinicians, people who are invested, and that's the problem.
I told
that is a big problem.
You don't need to go through bariatric. No. The infant is Monjaro. I said I should be taking injection every day. No, I'm not for that. So, let me do it once and for all. Let me get
absolutely.
it
and I agree. You've got a history of you're a teacher. You can assimilate content a lot, integrate, and decide. That is a factor or an aspect that requires attention and, of course, intelligence, but to an extent, discernment. Not everybody has the patience for that, and that's why they can sometimes, maybe go from one to the other before they finally reach a decision. A lot of it is just self-awareness, but also some level of.
I spoke with a professor of my colleague of mine on Monday when I felt a little bit. Said, you need to get the weight off, or you're in the hospital. After that, it's a state-by-state thing. I think she was the only one that could picture what I told her. My friend in the academia too. But she said, yes, you need to do the weight loss thing. Others were just, about 2-3 people that I discussed with when I recovered. They're just saying,
I mean, the thing I will say though, looking at it from the lens of where we have been, being involved in the space of weight loss in Nigeria, West Africa for the last sort of 16 years, I'm very encouraged in that the conversation is picking up. The content on the usual platforms, social media, whatever, is increasing.
It's increasing, I know.
It's increasing. So helpful in the context and the awareness. And I'm really, really relieved. Now, the lady you mentioned, I think, has made a massive impact because she's well known. She's obviously got a massive following. So her conversation, her stories are really resonating, and I think that that's good. And in fact, even in the UK, we had 1 or 2 individuals who helped to create spikes in requests. 1 or 2 ladies over the years. I just hope we have some men who have a lot of social following to come out. So that's what I'm hoping.
Men believe in it. Very few.
No. Gosh, no. In our
the guy you just
in our. I mean, if you look, just look at our outlay. 50% men. Just for this particular.
When I saw the young man there before, I said,
So we're gonna let you go home and rest.
Yes, I'm waiting for my son-in-law.
I'll see you Friday for a quick chat. The wound will be checked. I'll then see you again, obviously, on Monday. The key, obviously, is to keep yourself aware. Any issue, let us know.
She's there.
Any problems.
She's doing well. She's
and
there
then
for us.
Rest when you can, but keep active, of course.
I will.
And injections for your blood thinning.
Yeah, I did it this morning.
The blood twice a day.
So till evening again.
Yeah, exactly. And
she gave it to me, just pulled it like. Then she told me let it go in.
And then it's a needle small, so it should
very
be
tiny.
it's a small needle. So to say, obviously, thank you for now. We'll obviously have another one to come. But so far, signing out.
Yes, signing out.
Thank you.
I'm signing out.
Thank you. Good morning.
How are you today?
Very well. Good morning.
Thank you. How are you?
Good morning. Nice to see you. Good morning.
I'm fine.
Good, good. Please
make
yourself comfortable.
Thank you. At least I know that I walk straight now.
Good. Nice to see you.
It's nice seeing you too.
Nice to see you. Of course, we're a week now, 1 week.
Absolutely.
You had your surgery.
1 week.
And you're getting stronger day by day?
Stronger day by day.
What about your bowels? Have you managed to have a bowel motion?
Yes, I did. I had to send a message to Sherese when I couldn't. Good. It was a bit tough, but yes, she increased the dose
of that. Okay, so what are you on? What were you on twice? Okay.
And it was fine.
Okay. So that was what, a couple of days ago? Went to toilet?
Yeah. Okay. I sent a message to her.
Okay, bowels. Last 48 hours. And what about sleep? Have you been able to actually get some sleep?
When about 3 days that I got home, sleeping on my back was pretty difficult. Pretty difficult, but I'm not used to sleeping on my back. But about 3 days ago, I started sleeping on my side.
My left side,
because the side was healed a bit after the the dressing.
Surgery, the dressings.
Yeah,
I feel more comfortable on the left?
More comfortable now. Okay. Then I noticed by myself that, if I sip too much, I get this tightness here. So I control myself. Just sip.
Okay.
Just sip a bit. Maybe the sipping, if it gets too much.
Okay.
I get it and I feel it at my back.
Interesting. Okay. So that's really important. Very important.
Yeah, I got that since feedback. I corrected myself on the sipping.
Yeah, you've noticed.
I remembered. Sip gently.
Yes.
Slowly.
Yes.
So once I see that, I'll just sit up. Okay.
I take some deep breaths.
Deep breath. And my spirometer. Yes. Before I got here, I did the 10 greens.
Oh, wow, that's the number 3 one, right?
Yeah, the green one that's always been. But I do that all the time, okay. Every 1 hour. Then I increased from the 75 cl water to 1.5.
That's 1.5 liters, right?
Yeah.
That's good. And that including, is that the shakes? The shakes are separate, right?
The shake is 2 ounces.
It's separate, yeah?
It's separate.
So we've got the shake and the
water.
My juice. So by the time, and juice?
Juice, just 2 ounces, 50-50. Okay.
So you're looking at least what, 2 liters initially?
In a day.
Over the day, gently, yeah?
Gently.
Okay.
But my water...
You're happy with the intake?
I've taken the water as my friend.
Good.
So I sip a lot with my water.
Do they infuse water? They put anything in it?
We have
clean water.
No, you can. I think you can, and I think you should.
Okay.
So what your taste allows for, so infusing it with things that are going to be of value to your digestion. So you have options. There are options. You know, lime, lemon, cucumber. They're the ones that I personally prefer.
I'm happy with that.
I think, so it just gives it a little bit of some benefit, not just hydration. Okay. It helps the digestion. Lime and lemon and cucumber, they help the acidity. It cuts it back a little bit.
Okay.
It helps with just giving the gut a bit of signaling for movement. And it's a great anti-alkalizing agent and an anti-sort of oxidant.
Okay, I'll take my cucumber juice,
which is good.
I have one in my fridge.
Yeah, just cut it out, take all the little seeds out, and then just infuse it.